Dr. Joseph Cipriano, and today we have one of our patients. I actually saw him, what was it, about 2 weeks ago? 2 weeks ago, and at the time he didn't know who I was, but I ended up delivering an adjustment with the Y strap and everything, and I just kind of want him to tell you how he felt after.
Sure. I felt great afterwards. I've been coming routinely here since January, getting regular adjustments, and then after the last distraction, I had zero pain anywhere through working out or running or even just sitting for long periods of time. And it's been 2 weeks since I've been adjusted, and I've had zero problems working out or anything.
Okay, now do you mind if I read the Instagram message you sent me?
Yeah, go right ahead.
Okay, so the Instagram message that he sent me was, "Hi, you adjusted me at PPM about 2 weeks ago." PPM is Palmetto Physical Medicine. I didn't know you were famous, but on the real, after you adjusted me, I had zero symptoms. I was skeptical of your version of the ring dinger, but am no longer. Thank you for the spinal distraction. It was hard adjusting to having zero knee pain up or downstairs. I am sure my VMO hadn't fired like that in years. Running was new. I felt like a child trying to walk. I loved it. Thank you. I cannot put into words how much more functional I am. So for me, as a chiropractor, seeing things like that, messages like that, that's why I became a chiropractor. I love, just helping others and getting people back to, things that you love doing. So,
Yeah,
so you haven't been able to run for how long?
Well, I haven't been able to run properly
Okay.
for a very long time. And running, I had a shortened stride, so most of my large muscle groups were picking up for the small muscle groups.
Okay.
And then it was causing a lot of pain in different areas. And I came here originally it had gotten so bad it was all in my right hip. And my hip was then being replaced with these muscles on the left side. So now that everything's in order and I'm aligned and level, my stride is long, and it's definitely, I'm having to work the small muscle groups out. My time has increased, but that's okay. My distance has gotten farther.
Good.
So, especially, like I said, my VMO, vastus medialis oblique, I know some things. But that muscle right here, zero. It's brand new, so I'm feeling great.
Perfect. Well, let's go through. We're going to do an adjustment. I'm going to have you lay face down for me.
Okay, great.
Alrighty. So whenever I come in and start off with an adjustment, I always come down and I check the leg length on the patient. So he is a little bit short on that right side here. When I look up and I scan up on his body, his hips were a little bit rotated just like this. So what I'm going to be doing, we're going to do some drops. We're going to get the hips realigned back to level. So what I'm going to do, I'm going to push down on your sacrum like this. I want you to lift one leg at a time. I want you to lift your leg from here up, okay?
Okay.
So I'm going to push down right here. I want you to lift your left leg as high as you can. Any pain, tenderness, tightness with that?
No.
Relax that side. Do the right side. Any pain, tenderness, tightness with that?
No.
Okay, it looked like you had a little bit more difficulty lifting this leg than this one.
It was, yes.
Okay, so what I'm going to have you do, I'm going to have you cross the right foot over the left foot. Good. So the reason I'm having him do that is his sacrum is pointing more towards his left side, so it's easier for him to raise that left leg up and down compared to his right. The right just has a little bit more ligaments that are getting pulled on. So what we're going to do with the drops, we're going to take that sacrum that's turned like this, and we're going to recenter it back. Good. I'm going to have you uncross, bend just that knee for me. Okay, and if you want to come in and check this. So just with doing those drops, right after, as you can tell, the legs have completely balanced after that. So what we can tell is that issue was more of a sacral complaint going on there. So now what I'm gonna do is I'm gonna come up, I always check through the thoracic spine, into the lumbar spine. I'm feeling the muscle tonicity on either side, just like to make sure that things are symmetrical on bilaterally. So actually, to be honest, everything through here is actually feeling quite good. Low back is feeling good. I got a little bit of tightness here on that left side, so we'll check that in a second. Now up top we got, also a little bit of tightness on that left side too. So I'm gonna come in right here and we're gonna do the adjustment coming up top. So we're gonna be at the T2 level on this left side. Good, that moved very easily. And we'll come down to the T1 on that right. And that moved very well also. That just opened everything up throughout the, a lot of tension in that trap area. And then so we'll go through, see if any, get some movement like this. Yep, thoracics are moving very nicely. Good. Now what I'm gonna have you do, I'm gonna have you turn on your side and face me. We're gonna have you bend that top leg. Just like that. So that we're getting a little bit of tightness and tension in that left side here in that low back. We're just gonna go through and work this out here. Good. I'm gonna have you lay flat on your back for me. Okay. Good. Legs are balanced there. And turn to the side this way for me. Okay, let's just open up and get the lumbar spine moving a little bit better here. There we go. Felt that move?
Yeah.
Okay, so I'm gonna bring this headpiece down.
Okay.
Alrighty. So from here, this is where we go into the cervical spine. What I like to check is I go through and I check lateral flexion. So I bend his head going down and I'm feeling all the muscles and I'm feeling if there's anything fighting back when I'm pushing in here. So the reason we do this is you're checking each joint, how they move from one vertebra to the next. And when you have an area where it's not moving as it should, this is where we go ahead and make that adjustment. There it goes. Okay. So I'm gonna have you sit up. I'm gonna have you come all the way forward.
Okay.
So I wanna make sure that this thoracic spine is cleared out before we do that Y strap.
Okay.
One hand over the other. Good. I'm gonna have you take a deep breath in for me and exhale out. There we go. Good. Okay. So now that we have everything cleared out, this is where we're gonna do the Y-axis distraction. Now this technique, it has the strap that hooks over the base of the occiput, and what I'll be doing is I'll stand up at the top of the table and I'll distract in that Y-axis direction, and it decompresses the entire spine. So this was the move that really gave him a lot of relief, and he even noticed that going all the way down into the knees is where he got a lot of relief from. So we're going to be doing this technique today. There we go. And as I come up right up here at the top, we distract out. There we go. That rocked you on that one.
Oh man, it feels great.
So I know, you were at first, not sure 100% on the Y strap when, especially with watching the Ring Dinger and,
right.
Getting all the hype and the fame. So how would you describe the Y strap to someone who's never had it done? Like you feel that decompression.
I mean, you feel the decompression I feel it all the way down to about my mid back, or mid thoracic spine, and I mean, you can't describe it. I mean, it just feels great. It opens everything up, and I mean now I worked out this morning, but now I feel like my lungs have opened, even my nasal areas are open. I mean, I just feel clear all through my body.
Good.
It's the best way to describe it.
Yeah, that technique, what it's doing when I distract like that, it's pulling pressure off every nerve that's exiting the spine. So the whole point is when we take pressure off the nerve, is we're getting any pinching, anything, off. So we're allowing the body to heal and function as it properly should. Because every day you got to realize you go through and you got gravity pushing down on you, pushing down on you. So what you need, every person out there does need that nice decompression into the spine like that. So I'm gonna have you come on up. Probably grew about an inch there too after that one.
That's okay too.
But yeah, so we are all set. I am Dr. Joseph Cipriano, and today we're here at Palmetto Physical Medicine in Anderson. On Monday is actually going to be the opening of our new office in Greenville. So looking forward to that one. And if anyone is looking to get adjusted, to schedule an appointment, contact me. You know, I'll have everything listed in the description in this video, and love to see you come into the office and get better. Have a good one, guys.
Thank you.